Many of you might be tired of hearing the word COVID. However, specialists say we may be living with the after effects to our health for many years to come. KCTV5's Carolyn Long sits down with a cardiologist to hear what he's seeing in the clinic and operating room.
But then we very quickly learned that this is a very interesting virus that has the potential to affect every organ and every tissue in the human body, heart included.
Dr. DJ Lakkireddy, Kansas City Heart Rhythm Institute at HCA Midwest Health Medical Director, explains studies that show COVID can wreak havoc, not just on the lungs and respiratory system, but on the heart, too. In fact, studies are finding potential heart problems up to a year after the COVID infection, even in those who had a mild form of COVID-19. So anyone infected with COVID is at a higher risk for heart issues, including clots, inflammation, and arrhythmias, a risk that persists even in relatively healthy people long after the illness has passed.
It can cause inflammation of the coronaries, really causing acute blockages of the coronaries, causing myocardial infarctions, or otherwise called as heart attacks. It can cause clots in the deep veins, causing deep vein thrombosis, which can embolize or get loose and go up into your lungs and cause pulmonary embolisms. Interesting enough, it can also cause significant amount of inflammation of the heart muscle, the electrical system of the heart, and thereby really causing congestive heart failure, as well as several types of cardiac arrhythmias, especially atrial fibrillation, ventricular tachycardias, ventricular fibrillation, and subsequently causing sudden cardiac arrest and things like that.
Another recent study by the American Heart Association found that new onset AFib occurs in 1 of every 20 patients with COVID. Good news, AFib can be treated with medications or a procedure called cardiac ablation to restore a normal heartbeat, amongst many other cutting-edge treatment options. Dr. Lakkireddy says there's also potential for myocarditis, which they have a specific clinic for, so it doesn't worsen to congestive heart failure.
So knowing that, what do you think of the vaccine and the boosters? What do you tell patients?
At the end of the day, the incidence of such vaccine-related myocarditis is so low that that's not something that people should worry about. I mean, yes, you may take a vaccine and you may develop myocardial inflammation. That's something that we can deal with.
So how do you know if it's time for you to seek help from your family physician or a cardiologist?
So if you're one of those patients that had COVID infection and you start experiencing significant relentless fatigue and you're really not able to go on with your activities of daily living, if you're having lightheaded spells every single time you get up and start doing things, or you're having inappropriately rapid heart rates, like that is completely out of characteristic for what you're doing, skip beats, or significant episodes of chest pains that you can't really quite explain, I think these are all the things that you should really need to pay attention to.
Dr. Lakkireddy, it is always a pleasure chatting with you. Very insightful today. Thanks for joining us.
Thank you very much for the opportunity to be here with you.
For more from HCA Midwest Health, you can go to our website, kctv5.com, and click on It's Your Health.